Firstly, to vaccines, if I may, it's just a fantastic achievement to get to the 1 million mark ahead of that 5-week milestone. To have so many vaccines in arms in Victoria is an absolutely tremendous achievement. Every vaccine's another brick in a defensive wall against coronavirus, and it's another step on the way to those increased freedoms that we're all looking for. We have seen outstanding vaccination growth in coverage in some key areas in the past fortnight. First dose coverage, for example, has grown by 38% in the city of Melbourne over the fortnight. That's a tremendous increase, a necessary increase, because it was coming from a relatively low base. There is a young resident population in the city of Melbourne, but that increased coverage, again, is just a fantastic defence against the virus. It's grown by 35% in Hume and in Wyndham, and we've seen a 30% growth in Greater Dandenong and in Shepparton, and 28% in both Casey and Melton. That's a terrific achievement in just 2 weeks, and it really will contribute to slowing the spread of numbers in those local government areas. With respect to Ballarat, as the Premier said, there were signs of concern there. We've got 2 positive cases who were authorised workers who work in Ballarat, and today we've got 2 new cases who reside in Ballarat, household contacts of a case announced yesterday, and there are likely to be more cases. We've had positive wastewater detections from the 8th, and as we've said previously, that can sometimes mean someone passing through, someone who's recovered, but when subsequently you've got confirmed cases identified, that does make you think that those wastewater detections related to someone who was positive and infectious and not detected in the community, at least back to the 8th, and probably for some days before that wastewater pings positive. So it's been over a week of likely transmission within the Ballarat community. So there are likely to be more cases, and it's for that reason that going to an immediate lockdown is really the right response. Again, in line with the national plan, the national strategy for the shortest, sharpest lockdowns possible. It does give Ballarat the very best chance of opening up again in the shortest possible time, flagging a week, hopefully as soon as possible, lifting thereafter. And again, Shepparton has shown us the way that you can control even the Delta variant, even with dozens and dozens of cases, if you can quarantine all of those contacts, get very high rates of testing and drive vaccination all at the same time. The uptick in vaccination in Shepparton, obviously a response to the significant cluster there, but this is a point to make. If you are only now thinking of getting vaccinated because there are cases in your community, in your local government area, in your town or city, that should be a reminder to you that you need to book in at the earliest possible time. Don't wait for a case. They could come at any day, anywhere in Victoria, indeed anywhere in Australia. So please, if there are bookings available, make that booking now, because your first dose gives you some protection, but it takes a while to kick in. Your second dose is going to come 6 weeks later, and you'll need another fortnight until your immune system has kicked in to give you that full protection from hospitalisation, from risk of dying. So you've got about 8 weeks from that first decision to book in your first vaccine until you've got proper protection. So please don't wait for a case to pop up, for a lockdown to occur in your town or city before you say, oh, now I really need to get the vaccine. Not blaming anyone, I'm saying it's a lesson for everyone in Victoria, indeed everyone in Australia. If there are opportunities for you to get vaccinated today, tomorrow, please do so. With respect to Ballarat, there are a number of exposure sites on the website now, including the Lakeview Hotel in Lake Wendouree on the 9th and 10th between 7:15 and 7:55 in the morning, and again on the 10th between 9:45 and 11:30 a.m. The Big W in Ballarat on the 10th, 4:45 to 5:30 p.m. and the Forge Pizzeria in Ballarat, which is a pretty busy place in normal circumstances, on the 11th from 2:50 to 3:30 in the afternoon. As I say, there have been additional wastewater detections in Ballarat, and they do cover all of the wards of Ballarat. So that was part of the decision-making, recognising that there's probably been more widespread transmission than has been detected thus far. So if you're in Ballarat, please stay alert, be aware of symptoms, get tested if you've been to any of these exposure sites or if you've got even the mildest of symptoms. And if you've got that opportunity to get vaccinated and you've got no symptoms and you haven't been to exposure sites, please step up for the vaccine. There is a walk-in testing centre at the Ballarat Respiratory Clinic on Dana Street and a drive-through on Skipton Street. The great majority of people in Ballarat have had one dose of vaccine. That's a fantastic starting point. But if you're not amongst them, please get amongst them. Just to Yom Kippur. Obviously, it's a very challenging time for the Jewish community. This is the holiest of holy days on the Jewish calendar. And for the community not to be able to observe Yom Kippur in the way that they would like to do with such a significant day, not to be able to be in their synagogues is really difficult, especially given that the use of technology is not something that would normally be permitted for religious services in the Jewish community. We do want to thank the Rabbinical Council of Victoria for representing the Jewish community at such a challenging time. And from me, from all of us, we do wish the community Shana Tova and a Happy New Year and to be well over this period. Thank you.